Okay, so besides bone, we have cartilage as part of our skeleton. And actually, when we are fetuses, most of our skeleton is composed of hyaline cartilage that is then replaced by bone. And so I'm going to talk about the three types of skeletal cartilages, and you need to be able to identify them. So when we talk about these cartilages, some of the interesting things about them is that they have no nerves. So there's no nerve supply to them. This is not the same thing that is found in bone. We're going to talk about bone tissue, but bone does have nerves. And it has no blood vessels. So it is avascular. So that's what that means. Avascular means that there is no blood vessels. So that means that the nutrients and the oxygen and the carbon dioxide have to diffuse into the matrix and feed the cells and get rid of waste. And then all the waste have to diffuse out. And so you'll remember that cartilage is a type of connective tissue, but it is not a type of connective tissue proper. The connective tissue propers include tendons and ligaments, and also the loose connective tissues. So when we look at the different types of skeletal cartilages, we can talk about hyaline cartilage. And this is the most abundant type of cartilage in your body. And when we talk about cartilage in your body, this is probably the kind that you're talking about. So hyaline cartilage has lots of collagen in its matrix. It doesn't have elastin, so it isn't elastic. It has ground substance and proteoglycans, and it traps water. And so healthy hyaline cartilage is actually mostly water. Hyaline cartilage can be found in different parts of your body. And so when we call these cartilages, we're talking about, for example, the articular cartilages. Articular, when we talk about articular, we're talking about how bones articulate with one another at joints. And so this is, for example, at the ends of bones. So your shoulder is a ball and socket joint. The humerus, has cartilage on the outside. And then the scapula also has like this indentation, this fossa, and it also has hyaline cartilage. So you don't have bone rubbing on bone, but rather you have this cartilage. And also there is a synovial membrane that secretes synovial fluid, and it creates friction-free movement at the joint. So one note is that when we talk about osteoarthritis, which we're actually going to talk about when we get to the joints, this is inflammation of the joints, and it generally has to do with the degeneration of articular cartilage. So the degeneration of articular cartilage. Okay. We also have what are referred to as the costal cartilages. And costal means rib. And so when we look at our rib cage, it has some quite a bit of flexibility in it, right? And when we look at this rib cage, we see that some of our ribs are connected to our sternum, which is our breastplate, our breastbone. They are connected via these costal cartilages. So this functions to connect ribs to the sternum. Okay, one interesting thing is those ribs are connected to the sternum in the front, in the anterior, but posteriorly, they actually connect to your thoracic vertebrae. And that is what creates what is referred to as the thoracic cage. Okay, costal cartilages. We also have nasal cartilages. So this would be the external cartilages of your nose. You have a nasal bone, which is like the bridge of your nose, but the rest of your nose is actually cartilage, and it's actually hyaline cartilage. It seems to me like it's very elastic, but it's not as elastic as, say, for example, as your ear, which has elastic, it is actually elastic cartilage. We also have respiratory cartilages. Where are these? These are located in your trachea, for example, and also your larynx. So we have the larynx, which is your voice box, but we also have the tracheal rings. So you can feel those tracheal rings if you palpate the front of your throat, right? So those are part of the respiratory cartilages. Also, it's important to remember that in the fetal skeleton, most of our bones start out as hyaline cartilage and then they are replaced. So we have fetal hyaline cartilage, right? So we'll talk about that when we talk about the development of bones. Okay, so then we have the elastic cartilages. The place where these are, and elastic meaning that they have collagen fibers, but they also have elastin fibers. These would be the outer ear, and also in a structure called the epiglottis. And the epiglottis is a structure that actually prevents food from getting into your trachea. So when you swallow, it is the food that presses on the epiglottis that forces it down. And that is what actually closes off the trachea so that the food is shunted to the esophagus and then to your stomach. Okay. We also have fibrocartilage. And this is more fibrous than the other two. And you can actually see the fibers when you look at the microscope slides. You can also see the elastic fibers, they stain darkly. Collagen, when you look at the hyaline cartilage, you don't actually see the fibers. They are white. They tend to not stain those. So when we look at the fibrocartilage, this is the intervertebral discs, for example. So when people talk about slipping a disc or rupturing a disc, this is what they're talking about. Our vertebrae stack one upon the other, and it needs to be like a shock absorber. So instead of just bone, we have these pads of fibrocartilage, and it should be like a shock absorber, but sometimes it gets damaged and pieces of it come out and they can press on your spinal cord, or if it's in your low back, on your spinal nerves. And that can give you pain. One of the symptoms of the low back herniation is what is referred to as sciatic pain, which is pain that radiates from your low back and then all the way down your leg and to your foot. And that can be caused not just solely by a herniated disc, but that is one of the causes. When we look at our, we're going to talk more about these intervertebral discs, but it probably is not the best design. If you think about in other animals that are on all fours, they're not putting all of their weight onto these intervertebral discs. And when we stood up and became bipedal, then we had all of this compression on the intervertebral discs. And the intervertebral discs can actually dry out, and then they can not work, right? And then they can also herniate. And we're going to talk about the structure of the intervertebral discs when we get to the axial skeleton. Okay. So that's one place that those are located. Another one is the pubic symphysis. So this is where your two pelvic bones, your two coxal bones come together in the anterior, the ventral surface, right? And that is where you have a joint. that pubic symphysis is really interesting because in women that give birth naturally, oftentimes that has to relax. And so you get a little bit more mobility at the end of pregnancy. When you walk around, you might feel unstable. Your pelvis feels unstable because of the hormone called relaxin that kind of allows that joint to be more flexible. So the pubic symphysis is where they come together. Sym means coming together, and there's two pubic bones that come together in the front. So that would be two places where we have fibrocartilage.